Hello, welcome to Smartness tutorial session. Today we want to look at an important concept in medicine, which is acid-base balance. Did you know that a slight change in the pH of a blood can disrupt the organ system function? Yes, it can affect cellular function, it can affect metabolism, it can also affect the activities of the enzymes produced by the glands. Therefore, it is important that nurses understand the concept of acid-base balance so that we'll be able to identify and manage life-threatening conditions. So Smartness tutorial is here to simplify this complex concept for you today. Grab your pen and paper and let's get started. First, you want to look at is what is acid-base balance. We say it refers to the homeostasis of hydrogen ion concentration in a body fluids. So the body fluids can be blood, can be saliva, can be juices, can be all those body fluids that are found in them to maintain the normal pH. And so our key terms here is pH, homeostasis, and then hydrogen ion concentration. Now, when we say pH is a scale that helps to measure the concentration of hydrogen ions in a blood. And so we talk about pH, we are looking at the quantity of hydrogen ions in a blood. So when you take a patient blood sample, to know whether it is acidic or the blood is alkaline, we need to measure to know the quantity or the concentration of hydrogen ions in that particular blood. And we are saying it is expressed in a negative logarithm. What does it mean? It means that anytime our hydrogen ion is high, the pH that we are measuring should be what? Low. So anytime the hydrogen ion concentration is high, the pH of the blood is low. And that also means that anytime the hydrogen ion concentration is low, the pH will be what? High. So now we need to understand the values of the pH. We have the normal values and then we have the abnormal values. First, let's look at the normal values of the pH of a blood. Remember I said when we talk about the body fluids, we have juices, we have the enzymes, we have the saliva, we have the blood and all those things. But right now our concentration is on the blood. So the normal pH of blood is what? 7.35 to 7.45 millimeter per mercury. So this is a sample of a scale. As you can see, we have the one that is going to the negative side, we have the one that is going to the positive side. So the middle one, this is neutral, which is 7. This is neutral, which is 7. And then we have 7.35 to 7.45, which is what? The normal pH of a blood. That means that the blood itself is slightly alkaline, which is also a keynote to take for students, because the question can be asked on this, that which of the following statements best describe the blood? And then they will give you the options. A, it is alkaline. B, it is slightly alkaline. C, it is acidic. And as I said, as you can see the value, I say the neutral is 7. Okay, the neutral for the pH scale is what? 7. So anything below 7 is what? Acidic, and anything above 7 is what? Alkaline. Now the blood falls within 7.35 to 7.45. That means that it is what? Slightly what? Alkaline. Now, as I said, we have the normal values for the blood and then we have the abnormal values for the blood. So anything that is going to this side, which is what? Less than 7.35 is what? Acidic. So when the pH of the blood shows a figure less than 7.35 millimeter per mercury, we say it is what? Acidemia, or it is what? Acidosis. And then anytime the pH of the blood is more than or greater than 7.45 millimeter per mercury, we say the blood is what? Alkaline. Now, another key term that we need to also understand is what? The homeostasis. So it means that the body always tries to balance the alkaline substance and then the acidic substance in the blood to ensure that they are in a normal value within the 7.35 to 7.45. Now, that means that the blood has some aspect of acid substance and the blood also has some aspect of what? Alkaline substance. Now, what quantity of blood, what quantity of acid, and what quantity of alkaline is needed to ensure that the pH stays within this normal value? Now, let's look at this. So, in here, we have a carbonic acid, we have bicarbonate here, and then we have a carbonic acid here. This is bicarbonate, which represents alkaline. And then this is carbonic acid, which represents acid. So for the pH to remain within the normal value, all the time, the body needs to ensure that we have 20 parts of an alkaline substance, which is mainly bicarbonate, and then we have 1 part of carbonic acid, which is what? Acid. And that will ensure that the pH is always within the normal value, which is what? 7.35 to 7.45. Now, this means that anytime there's a change, either in the bicarbonate or the alkaline substance, or there's a change in the carbonic acid or the acid value, then that is where we are going to have an imbalance of the acid base. And so our topic now is going to be, we are going to focus more on the imbalance. That is what? Acidosis or what? Alkalosis. But before we get to this, let's try to understand how the body tries to ensure that they keep the pH of the blood within these values. So we want now to talk about regulation of acid base. To ensure that we have 20 parts of bicarbonate and then we have 1 part of carbonic acid to make sure the pH of the blood is within 7.35 to 7.45 milliliter per mercury. Now, one way that the body tries to do this is the buffer system. Buffer system. So 1, buffer system. How does the body do this? So the buffer system simply means that the body tries to change strong acid into a weaker acid so that the body, the kidney, or the respiratory system will be able to excrete it easily. That is one way of, so anytime the body notices that the blood is acidic, all that they try to do is that they change strong acid into a weaker one so that the kidney or the respiratory system can excrete it. Another way that the buffer system also helps to regulate acid-base balance is through what? Albumin. So we have the albumin buffer system. How does this thing happen? When there are a lot of hydrogen ions in the blood, which are moving freely in the blood, the albumin binds with the hydrogen ions so that they reduce the hydrogen ion concentration in the blood. So it means that when there's acidosis, albumin will bind with the hydrogen ion. Remember we said that anytime the hydrogen ion is high, the pH is reduced, and when the pH moves to the negative side, it becomes acidic. And so what the albumin will do is to bind with the hydrogen ion so that they cannot move through the blood, and that will reduce the amount of hydrogen ions in the blood. And that will now help to move towards the alkaline or the alkalinity side. That is one aspect of how the body regulates the acid-base balance. Another one is through the use of the renal system. The renal system. So the kidney, we know the kidney helps to conserve, and the kidney also helps to excrete unwanted substances. So the kidney do that through hydrogen ion excretion. So if the blood is acidic, the blood that is getting to the kidney, the blood that is getting to the glomerulus, the nephron, when it detects that it is acidic, all that it do is that they excrete hydrogen ions and then rather conserve bicarbonate. rather conserve bicarbonate, so that they will now shift the acidity of the blood towards the alkalinity side in order to maintain what homeostasis, to ensure that it is what 20:1. And so in the other way around, if the blood that is getting to the kidney or the blood that is getting to the nephron or the glomerulus, they also notice that the blood is alkaline. Then what they do is that they excrete bicarbonate and then conserve hydrogen ions, and that will also help to maintain homeostasis. Now, the third way that the body also try to ensure homeostasis of the pH is through the respiratory system. Now, with the respiratory system, there are two main compounds that comes into mind when we talk about regulation of the acid-base balance through the respiratory system, which is carbon dioxide and oxygen. Now, again, when the body notices that the blood that gets to the lungs is acidic, what they do is that they help to excrete carbon dioxide from the lungs. That will help to shift the acidity towards what the alkalinity. Now, someone will ask, how does carbon dioxide affect the acidity of a blood? Now, when you have carbon dioxide in your system and the carbon dioxide gets into the blood, now the blood is made up of water. And so when the carbon dioxide combines with water, they form carbonic acid. So carbonic acid, so it means that we are going to have our H2 here, and then we are going to have our CO2. But remember, we have another O here, which will add up to become what? 3. And that becomes what? Our carbonic acid. And so we are saying that excess carbon dioxide in the lungs diffuse into circulation, combines with water to form what? Carbonic acid. And so if the respiratory system wants to help to reduce the acidity, all that they try to do is to ensure that they get rid of carbon dioxide from the lungs. And so anytime we have less carbon dioxide in the circulation, we will have a less amount of it to bind with the water to form the carbonic acid. That means that we are at the same time reducing the acidity of the blood. So these are the three main ways in which the body tries to regulate the acid-base balance. If you like it, share it, press on the thumb, and subscribe to get more videos. Now let's continue. So remember earlier on, we talked about the values of pH of a blood. We said we have the normal value and then we have the abnormal value. With the abnormal value, we have the acidosis and then we have what? Alkalosis. Now, before we get into details with acidosis and alkalosis, let's first try to understand some of the compounds that when get into the body or when the body produce, they lead to acidosis, and some of the compounds that will lead to what? Alkalosis. Let me still put the ratio here, which is the bicarbonate, and then we have the 20:1, which is the alkaline, and then the carbonic acid, and then the pH. We said the normal is 7.35 to 7.45 millimeter per mercury. And then the acidosis, we said anything less than 7.35 millimeter per mercury. We have alkalosis, anything greater than 7.45 millimeter per mercury. Now we want to look at compounds that are acidic and compounds that are alkaline in nature, so that you'll be able to understand if you have this substance in the body, what is it leading to? Is it leading to acidosis? Is it leading to alkalosis? Now, so acidic substances, one, we have our hydrogen ion, because that is the main thing that we are looking at in the pH. And then we also have hydrochloric acid, which is being produced by the stomach. And then we also have carbon dioxide, where we can get it from the respiratory system. And then we also have lactic acid. And lactic acid comes about when the body tries to break down food substances to generate glucose anytime the oxygen level is low. So that is what anaerobic respiration metabolism. The end product is what lactic acid. And then also when the body also tries to break down fat, the waste products that we also get is what ketones. So all these things are acidic substances in the body. And so when we have high amounts of these things in the body, it means that the pH of the blood will be low, and that will lead to what? Acidosis. Now let's look at compounds that are alkaline in nature. And the first one that we all know is the bicarbonate. Okay, so bicarbonate is alkaline in nature. And where can we find bicarbonate? We have bicarbonate in the kidney, we have bicarbonate in the intestines. And then another one is what? Oxygen. And so when we breathe in oxygen, oxygen is what? An alkaline substance. And then another one that we can also look at is these food substances that we eat. The soda and all those things are also alkaline in nature. Now, why do we have to understand where we can get these substances from? As I said, we have hydrochloric acid, which is being produced in the stomach. So maybe a question can be like, a patient has undergone gastrectomy. The nurse is assigned to this patient, will monitor for which of the following acid-base imbalance. So you have someone that has undergone gastrectomy, and you know that gastrectomy is about what? The stomach. And the stomach, that is where the hydrochloric acid is being produced. So if a patient has undergone gastrectomy, where a portion of the stomach is being removed, and if it is about where the parietal cells are, that means that we are going to have a less amount of hydrochloric acid being produced. So that patient, the nurse have to monitor for what? Alkalosis. Because that person is not producing acid. That means that the acid level is going to what? The ratio of the acid level is going to what? Change. And so that patient is at risk of what? Alkalosis. But to determine whether it is respiratory alkalosis or it is metabolic alkalosis, we are now going to start with it. So we are going to start with the main concept, which is what? The acidosis and what? Alkalosis. But keep these things in mind, that anytime these substances go up, it leads to what? Acidosis. And anytime these substances in the body goes high, it also leads to what? Alkalosis. Now, that also means that anytime these substances in the body are low, so first we said that when these substances are high, it will lead to acidosis. It will lead to alkalosis. That also means that anytime these substances comes down, we are heading towards what? Acidosis. When the alkaline substances are high in the body, it will lead to alkalosis. But when they are low in the body, it can lead to what? Acidosis. In the same way, when these acidic substances are high in the body, it will lead to what? Acidosis. But when they are low in the body, it will lead to what? Alkalosis. Now, let's start with either acidosis or alkalosis. Alright, so now let's take it one after the other. First, let's look at acidosis. Acidosis. Acidosis simply means a pathological condition or changes that occur when there is a high concentration of hydrogen ions in a blood, and that is known as what? Acidosis. That means that the pH of that blood is less than 7.35 millimeter per mercury. Now, what can cause acidosis? It can be a respiratory issues or can be a metabolic issues. And so we have two main categories or classifications of acidosis, which is respiratory acidosis, and then metabolic acidosis. And so the type of acidosis depends on the etiology or where the problem is coming from. So if the acidosis occur because of an issue with respiration, then we say it is known as what? Respiratory acidosis. But if it has to do with issues of metabolism, then we say it is known as what? Metabolic acidosis. So we are going to take respiratory acidosis. When we are done, then we'll talk about metabolic acidosis. So we can define respiratory acidosis as a pathological change that occurs when there's a high concentration of hydrogen ions in the blood as a result of respiratory issues or respiratory problems. Now, when we think about respiratory acidosis, what compound comes into mind? What compound is acidic that has something to do with respiration? All that we think about is what? Carbon dioxide. And what happens for an individual to have high amount of carbon dioxide in the lungs or the blood and less amount of oxygen in the lungs or the blood? One, it is just simple: hypoventilation. So when you think about respiratory acidosis, just think about hypoventilation, or we say slow breathing. So just for you to remember, when we say respiratory acidosis, just say slow breathing. Respiratory acidosis is just about what? Slow breathing. So if you are looking at the causes of respiratory acidosis, is any respiratory condition or anything that will cause the individual to breathe slow, and that means that the person is retaining carbon dioxide, and when carbon dioxide combine with water, they form carbonic acid, which will lead to the respiratory acidosis. So let's look at the causes. And all that we need to think about is any condition that will cause slow breathing, that will help retaining carbon dioxide in the lungs. So one, we can look at the CNS. What condition can cause an individual to breathe slow as a result of a CNS? We have the Guillain-Barré syndrome. The Guillain-Barré syndrome is just about demyelination of the nerves, and if it is from the central, if it is from the hypothalamus where the respiratory center is, that means that the individual will not be able to breathe better, and that will cause the individual to retain carbon dioxide, and that will lead to what? Acidosis. Then we also have hypothalamus issue. Maybe there's a trauma or injury to the respiratory center. So trauma to respiratory center in the hypothalamus. That is about the CNS. Now let's look at the respiratory system itself. What condition that can affect the respiratory system that will make the individual to breathe slow, which will lead to retention of carbon dioxide? Because we said that when carbon dioxide combines with water, they form what? Carbonic acid. So anything that will cause the individual to breathe slow and retain carbon dioxide will lead to what? Acidosis. So what condition? We have asthma. You know, in asthma, the bronchial arteries are narrowed, and that will cause a difficulty in breathing. That will lead to what? Hypoventilation. Then we also have COPD, chronic obstructive pulmonary disease. They find difficult to bring out carbon dioxide, and so there's a retention of what? Carbon dioxide. Then we also have conditions like what? Pneumonia. So in pneumonia too, it can also lead to what? Respiratory acidosis, because the person will breathe slow and retain more carbon dioxide. Then we can also talk about conditions like atelectasis. Atelectasis, where the lungs collapse. So if the lungs collapse, then it means that they will not be able to bring out the carbon dioxide, leading to a retention of what? Carbon dioxide, combining with water to form carbonic acid. Then let's look at drugs. There are some drugs that when the individual is being given can also slow breathing, and that will lead to what? Retention of carbon dioxide. So we have sedatives like diazepam, and then we have painkillers like the opioids, or depress the respiratory center, and that will cause the individual to breathe slow, which will lead to what? Retention of carbon dioxide. So, understanding this, if you want to look at the clinical manifestation that this individual will exhibit, first we need to think of so let's look at the clinical manifestation. Someone who is breathing slow, retaining carbon dioxide, what will be the clinical manifestation? First, let's look at the respiratory system. What is going to happen? So there's going to be shortness of breath. That is what? Hypoventilation. Now, when there's shortness of breath, that means that there is a high amount of carbon dioxide in the blood. And when there's a high amount of carbon dioxide in the blood, it can also affect the cardiovascular system. So with the cardiovascular system, carbon dioxide causes constriction of the blood vessel, and that will also what? Increase the heart rate. So with the cardiovascular system, we have increased heart rate, which is what? Tachycardia. And since the heart rate is increased, then automatically the blood pressure will also increase. So that means that the clinical manifestation, we have shortness of breath, we have tachycardia, and then we have what? High or elevated blood pressure. Then we have central nervous system response of respiratory acidosis. When there is excess carbon dioxide in the blood, which is what? Hypoxemia. When this blood gets to the brain, it also leads to certain clinical manifestations like confusion. It can lead to dizziness. It can lead to drowsiness. It can also lead to disorientation. So we have a lot of clinical manifestations that these patients will exhibit. Now, the respiratory acidosis can also affect the electrolyte balance in the system. So let's look at the electrolytes. The electrolytes. Now, when there's high amount of hydrogen ion in the blood, it causes potassium from the intracellular to shift into the extracellular, leading to hyperkalemia. Leading to hyperkalemia. Anytime there's acidosis, the acidosis causes hydrogen, and the acidosis causes potassium from the intracellular fluid compartment into the extracellular fluid compartment, leading to hyperkalemia. And when there's hyperkalemia, another clinical manifestation is what? Dysrhythmia. Dysrhythmia. So with the clinical manifestations of respiratory acidosis, we have shortness of breath, tachycardia, we have elevated blood pressure, we have confusion, dizziness, drowsiness, hyperkalemia, and then dysrhythmia. Now let's look at the nursing management. So the nursing management is symptomatic and at the same time depends on the cause of the respiratory acidosis. So we'll talk about use of opioids. So if the person is on any opioids which is causing slow breathing, then we need to what? Let the person cease the intake of all opioids. So one, we can talk about what? Cessation of opioid drugs. And then we can also talk about administration of prescribed bronchodilator. Remember we said one of the causes of respiratory acidosis has to do with asthma, COPD, which may occur as a result of narrowing of the airway. And so if that is what is causing the condition, then we need to give what? A bronchodilator in order to dilate the airway to enhance exchange of gases. Then another one we can also do is about nursing position. So we nurse the patient into a semi-fowler's position to enhance breathing. Then we can also look at these ones where we will talk about assessment or assessing vital signs, because we said there's going to be tachycardia, there's going to be elevated blood pressure. So all these things we need to monitor to know the progress of the condition. And then we also need to monitor the EKG or the ECG of the patient to know how the heartbeat is going. So now we can move on to another condition. Now let's look at metabolic acidosis. So when we talk about metabolic acidosis, it also means that there's a high concentration of hydrogen ion in the blood as a result of metabolic problem. Now, when we talk about metabolic acidosis, it's mainly about one, it is about failure of excreting hydrogen ions. Failure of the body to excrete hydrogen ions. And then two, over production of hydrogen ions or acidic compounds. And then three, excessive ingestion of acidic compounds. Or we can look at depletion of bicarbonate substance. Depletion of bicarbonate substances. These are the main causes of metabolic acidosis. So we talk about failure of excretion of hydrogen ions, because we said that anytime hydrogen ion concentration is high in the blood, it leads to what? Acidosis. Now, because this has nothing to do with the respiration, we say it is what? Metabolic acidosis. So how does the body fail to excrete excess hydrogen ions? One, if there is renal failure, the kidney find it difficult to excrete waste products, and that will lead to what? Metabolic acidosis. The waste product that we are interested here is what? Hydrogen ion. So when there's renal failure, the kidney is not able to excrete excess hydrogen ions, and that will lead to metabolic acidosis. And then overproduction of hydrogen ions or acidic compounds can also lead to metabolic acidosis. Now, for instance, when there is starvation, when there is diabetic ketoacidosis, all these things can also lead to what? Metabolic acidosis. So when there's starvation, the person is not eating, the body tries to break down fats and in order to generate glucose for the body, and that will lead to the production of what? Lactic acid, which will lead to metabolic acidosis. And also when the body when there's an uncontrolled diabetes, okay, the body again try to generate glucose by breaking down either the proteins or by breaking down fats, and that will lead to accumulation of lactic acid and ketones. That would lead to what? Diabetic ketoacidosis. So that one, because it is about metabolism, we say the person is having what? Metabolic acidosis. Then excessive ingestion of acid compounds. And so there are certain food substances that are acidic in nature. There are also certain drugs that are also acidic in nature. Excessive intake of this drug can also lead to metabolic acidosis. An example is aspirin. So excessive intake of aspirin can also lead to metabolic acidosis. Or maybe you take citrus fruit that has so much acid in them, can also lead to what? Metabolic acidosis. And then depletion of bicarbonates. And so, for instance, when a patient has frequent loose stool, the person is losing bicarbonate because the sodium bicarbonate is found in the intestine. And so when you are having excessive diarrhea, you can also that means that, so since when you are having excess diarrhea, you are losing bicarbonate, and the bicarbonate is supposed to be 20 parts, and then we have carbonic acid to be what? 1 part. And so as the individual is having that diarrhea, you are losing some amount of bicarbonate, and that will change this one, the ratio of the bicarbonate, and that can also lead to what? Metabolic acidosis. Now, let's try to look at the clinical manifestation that these patients will exhibit. So when a patient is having metabolic acidosis, what will be the clinical manifestation? So first, we also have the CNS response. How is the central nervous system going to respond to metabolic acidosis? So again, here too, we have our headache, we have dizziness, we have confusion, and then also disorientation. Then the respiratory system. How is the respiratory system going to respond to metabolic acidosis? What they will try to do is that they will cause the individual to breathe faster and deep. Faster and what? Deep, which is known as the Kussmaul respiration. So Kussmaul's respiration is a physiological response by the respiratory system when there is what? Metabolic acidosis. And so patients with diabetic ketoacidosis also experience it because they are also having what? Metabolic acidosis. The body causes the individual to breathe faster and deep, and that is known as what? Kussmaul's respiration. And then again, we can also talk about the electrolyte imbalance. So again, here too, metabolic acidosis is also another type of what? Acidosis. And I said that anytime there is acidosis, which means that there's a high amount of hydrogen ion in the blood, what happens is that the potassiums move from the cells, that is what? Intracellular, to the extracellular, causing excess amount of potassium in the blood, which will lead to what? Hyperkalemia. So here too, we also have what? Hyperkalemia. And then since there is hyperkalemia, it can also lead to clinical manifestations for the cardiovascular system to be dysrhythmia. Dysrhythmia. Then can also lead to muscle weakness, just like the respiratory acidosis also. Now, so how do we manage this condition? How do we manage this condition? A patient with metabolic acidosis who is having all this clinical manifestation. So one, again, observation and assessment. We need to monitor the patient for dizziness. We need to monitor the patient for disorientation. We need to ask questions. What is your name? Where are you? To know that the person is oriented to time and place. And then we also need to ensure that we nurse the patient using what? Side rows, because we said the person is confused. Okay, this also applies to the respiratory acidosis. We need to provide side rays. We need to ensure that injurious substances are not placed within reach of the patient because of the confusion. And again, to also help with the respiration, we can also there's the patient in a semi-Fowler's position, and again administer prescribed oxygen. So oxygen is also needed for metabolic acidosis and respiratory acidosis. The reason is that oxygen is an alkaline substance, and that will go to help to neutralize the acidity of the blood. So oxygen administration is needed for both metabolic acidosis and respiratory acidosis. Then again, we also need to take blood sample to measure the electrolytes. And here we are interested in the potassium level, okay? So that we know whether there is hyperkalemia or there is a normal potassium level in the blood. All right, so let's quiz ourselves with this question. When we say a nurse is assigned to a patient with the diagnosis of a cholera, the nurse will monitor the patient for which acid-base imbalance. So the key term here is the diagnosis, which is what? The cholera. And when a patient is having cholera, we all know one of the clinical manifestation is the key clinical manifestation is diarrhea. So the patient is bringing out unwanted substances, and we know that in the intestines we have an important compound in the intestine, which is what? Bicarbonate. So when you are bringing out bicarbonate, it means that the ratio of the bicarbonate to the carbonic acid will change. You will no more have what? The 20. And that means that the acid level will what? Increase. So it means the person is at risk of what? Acidosis, because you are reducing the amount of bicarbonate. Now we need to think whether it is respiratory or metabolic. So we have established the fact that this patient is at risk of what? Acidosis. So is it respiratory or metabolic acidosis? Now, we said that respiratory acidosis occurs when there's a problem with what? Breathing. But this patient has, the condition did not tell us that the patient is having a problem with what? Breathing. That means that it becomes what? Metabolic acidosis. So our answer is what? A, metabolic acidosis. Please, do you get it? Yes. Now, let's see if I change this. Let's say I change this to a patient who is having excessive vomiting. what would the nurse monitor for in terms of acid-base imbalance? The patient is vomiting, and vomiters come from the stomach, and in the stomach we have a compound over there which is of interest to acid-base balance, and that compound is hydrochloric acid. So when we are bringing out the hydrochloric acid, it means that the acid level in the body is also what? Reducing. That will affect the ratio between the bicarbonate and the carbonic acid. So since the person is losing acid, it means the alkaline substances is what? Going up. So that means that this patient is at risk of what? Alkalosis. Now we need to determine whether it is respiratory alkalosis or metabolic alkalosis. And when you look at the stem of the question, there is nothing that has to do with what? Respiration. So now it means that we have to go for what? Metabolic alkalosis, which is the C, metabolic alkalosis. I hope this video will help you a lot. Thank you. We meet next time.